Hey everybody, it is Wednesday morning. This is part 2 in our pain management series that we're doing on treatments. There's not a lot of specific info here. This is more on what you could be offered and what to watch out for and what might work. So the last video we did traditional medications and modalities. Today I'm going to do more of the alternative modalities. I've got my notes with me again, and if something's listed in this alternative category, it may not be technically quote alternative. It may just mean that insurance doesn't typically cover it, or it may be something you can get over the counter. But it's all things that are not traditionally used if you go into your provider to get help with pain. So let's get rolling with alternative medications. First, you could try turmeric. In the studies, this has been shown to be as effective as a 200 milligram ibuprofen. You can get this over the counter. It does seem to be quite helpful. Next, you can do vitamin D. You need to have your levels checked, because if your vitamin D levels are low, you could certainly benefit from replacement. Not only does it help pain, it helps chronic fatigue and things like that as well. So I would get your vitamin D level checked, and if it's low, get on some replacement. Just make sure if you go to your doctor to get vitamin D replacement, you get vitamin K and magnesium with it, because that really helps the absorption of the vitamin D. Next, you could do something like Boswellia. That comes in a capsule or a cream. These work pretty well. We actually have these in our office and use it and sell this here. It is pretty good for mild pain. It seems to work about as good as ibuprofen. Next, you could do CBD. The number one use of CBD is chronic pain. The number one use of CBD is pain, not chronic pain, but just pain in general. Also good for anxiety and sleep, among many other things. But in our office, we use full spectrum CBD. That means it has all the cannabinoids in it, things like THC, CBD, CBA, CBG, CBN, several four-letter cannabinoids that I cannot remember. It also has terpenes and flavonoids in it. And these really come together to work to help with inflammation and pain and all the other things that CBD is good for. We have capsules, we have gummies and oils. This also comes in a cream or a salve. For localized pain in muscles, for soreness or cramps or joint pains, this salve is fantastic. Some of the best stuff that we have. We sell a ton of this stuff because it works so well. Next, you could look at doing medical marijuana. We offer medical marijuana cards here. You have to go out of state to have it. Some states it's already legal and you can buy it, but if you have one of the, I believe, 21 indications, you can get medical marijuana and have that legally. It does work for some things, and we have seen benefit from it. Next, you could try low-dose naltrexone. This is a prescription medication at high doses. At low doses, it's still a prescription, but insurance does not cover it. At low doses, it works different than it does at higher doses, and we're using it for a lot of autoimmune problems. We use it for post-COVID, things like that. It can be used for weight loss, but it is an option for chronic pain and inflammation and does seem to work pretty well. It is not horribly expensive. It's about $60 for a 3-month supply, somewhere in there. Next, you can do omega-3 fatty acids. These are good to help lubricate joints. You have to have good fats in your body, and these work well for that. So if you are having pain issues, you could get these over the counter and see if it helps. Just make sure you get a good quality on any of this stuff. You want to research what you're getting to make sure that it's a good quality product and not something that you're just finding on Amazon. Next, you could try ozone therapy. We do ozone injections here into your joints. I am a big fan of ozone. You can also do rectal, bladder, and vaginal insufflation of ozone. And lastly, you can do what's called major autohemotherapy with ozone. We are not set up to do that yet. I would like to get that here in the office at some point, but that's basically where we would take some of your blood out, infuse it with ozone, and put it back into your body. This seems to work awesome, and the people that have had it that I've talked to and in case studies have had really good results with that. Next is platelet-rich plasma. This is where we would draw your blood, spin it down, draw the plasma off the top, and then we would re-inject that into your joints. This does cause a little bit of an inflammatory reaction for the first day or two, but after that it really seems to help joint pain. Next, we're using a lot of magnesium for headaches, for cramps, for anxiety and depression. You can't get any magnesium. The magnesium that's sold over the counter typically is magnesium oxide or magnesium citrate. These are not absorbed and are good for constipation. You need to get a different form of magnesium, maybe something like magnesium glycinate, which is a good all-around form, or magnesium threonate, which crosses the blood-brain barrier and is good for headaches and anxiety and depression, things like that. Next are some creams that you can potentially get, and we're using these. You get these from compounding pharmacies, and I put these in the alternative form because insurance doesn't typically cover them, but these pharmacies are mixing Neurontin, NSAIDs like diclofenac or ketorolac, and lidocaine into a cream for a localized application, and patients love these. They help a lot, and you don't have to worry about the addictiveness of Neurontin and the other side effects so much if you're using it locally. So these are a great option. And lastly are peptides. We do a lot of peptide therapy. Things like BPC 157, TB 500, those are awesome peptides for pain and inflammation. They come injectable. BPC actually comes in a capsule as well. We're using them for osteoarthritis. We're using them for back pain and other types of pain, neck pain, things like that, and having wonderful results with those. There are some other things you can use for chronic pain and inflammation as well, but that's just two examples. Just be sure that if you wind up going the peptide route, that you know what you're doing as far as mixing and dosing. Most people can order peptides. It is a little difficult to order just because of the ordering process, and these things are, quote, research chemicals only and not for human consumption, but that is what they have to put on their website for legality reasons. But these things do work very, very well, and there's very few side effects to them. Very few drug interactions to them as well. And I'm sure most of y'all have heard of Ozempic and Mounjaro. These are peptides, just not for pain, they're for weight loss. So that's about all I have for medications. Next, there's some other modalities that you may be able to utilize to help with your pain. First would be chiropractic care. Chiropractic care seems to work well for many different things, for headaches and chronic back pain and things like that, and we do utilize that. I refer people to chiropractic frequently. I've used it, my kids have used it, and it has really helped. So if you're having pain issues, why not look at a chiropractor? Sometimes they do take insurance, sometimes they don't, but a lot of times even if they don't take it, you can submit your bill to the insurance company and get reimbursed. Next would be osteopathic manipulative therapy. This is very helpful. If you get a skilled practitioner, they can really help with pain management by manipulating your bones and muscles and things like that. Next would be massage therapy. Massage therapy is very good. When you get in deep in a muscle and massage it, it stimulates blood flow, therefore stimulating healing. So look at massage therapy. Next would be just simple stretching. There are some places popping up around now where you can go in and people will stretch for you. They will do legs and backs and arms and things like that and really get in deep and have good stretching for you. If there's not a place like that close to you, look online and you can find plenty of stretching exercises and regimens to do for various things and injuries. Exercise. Exercise is simple. Anybody can exercise. Even if you're in a wheelchair, you can exercise. You can get a can of soup and start curling soup in a wheelchair. You can try to do leg raises. If you're not paralyzed, you can sit in a wheelchair, raise your legs up. If you can't walk and you're on a couch, you can do anything. Just Google exercises to do if you're immobile. But any type of exercise will help pain. It will help stimulate blood flow. It will help work your muscles. All that is beneficial not only for pain but for many other problems as well. If you need help with that, ask your doctor, your nurse practitioner, your PA. Anybody in the healthcare field can probably help direct you in the right direction to get you exercising. Next would be to improve your diet. We talk about diet all the time. I'm not going to go into that here, but diet is a huge issue with chronic pain. Improve your sleep. Sleep is another issue. If you're not getting good sleep, you can be in pain. So work on your sleep.